Good morning, fellow students, and welcome to the COVID-19 workshop. The purpose of this workshop is to educate people around COVID-19 and to also give guidance and just to point out key issues around COVID-19. My name is Twanelo Mogoto, and I am your facilitator for today. I am presenting to you from the Cape Peninsula University of Technology. On the guide you have with you, you should see that we have shared a password with you, the Wi-Fi password, which will assist with the exercise that we will be doing shortly after the presentation. So we will be discussing what COVID-19 is, also known as coronavirus, SARS-CoV-2, and the common name COVID-19. So COVID-19 is caused by a severe acute respiratory virus, which causes mild to severe or moderate respiratory illness, and that is mostly on infected individuals. Some people develop serious illnesses, especially older people, and that have current medical conditions like chronic issues. But then, with that being said, it can also contact anyone. The virus can contact anyone, as we all have different immune systems. But it is very important to take note of the following steps. What we'll be going through again is the national statistics on COVID-19. So we all know that COVID-19 has been around for quite some time now, and what the cases that we've had reported thus far has been up to 4 million, which is quite a large number nationally. And we've also had reported deaths, which is up to 100,000, and also recoveries, which is up to 3 million. So that is quite a lot. And is there any questions so far? All right, we'll continue. Module 3 are the stages and the symptoms of COVID-19 infection. So in the initial stage, which is the first stage, which is a flu-like symptom. So in this case, a person can experience fever, chills, coughing, exhaustion, severe headaches, nausea, vomiting, diarrhea, and shortness of breath. However, some people, about 47% of people, have zero symptoms in this case, which does poses a risk, as you can never know earlier to prevent the illness from getting worse. The next stage is the pneumonia or respiratory symptoms. So in this stage, the COVID-19 becomes severe and causes pneumonia, and which requires a respiratory treatment. So in this case, then you would find that as you struggle with breathing, you struggle with your chest pains, and you would require some oxygen for you to be able to breathe. There are different treatments that can assist in this case, which include breathing exercises and some antivirals, which we will be discussing shortly, and including some medication that also can help throughout this time. In the other stage is organ failure. So this is literally the last stage once the illness is getting worse, which leads to organ failure, and you would need some chest tubes for you to be able to survive, as it clogs your breathing system, so it becomes difficult for an individual to breathe properly. Module 4, main types of COVID-19 transmissions in South Africa. We have quite a few, and we will be discussing just some of the transmissions in South Africa. The first one is the contact and droplet transmission, whereby the infected COVID spreads right through saliva and respiratory secretions and close contact with infected individual, which can be direct or indirect infection with the close contact of the infected individual. In this case, we can unintentionally transfer the infection of COVID-19 by not covering our mouths with masks. So this is another way of transmission of COVID-19 in South Africa. The next one will be, and then we have the airborne transmission, which is very similar to the contact and droplet transmission. It involves spreading infectious aerosols through inadequate ventilation. So we could be in a confined space altogether, and the virus is just spreading through around the area. And then again, we have a fomite transmission, which is contaminated surfaces can also become fomites due to the respiratory secretions or droplets, causing the virus to be found for hours to days around the facilities or areas that we could be in. So it could involve touching surfaces. It could involve the exchange of items, which could be contaminated with the virus. So it involves contaminated surfaces and areas or items that could be exchanged during the process. And then there are more questions related to the transmission of COVID-19. There are different ways. However, we've covered the most common ways of the transmission of COVID-19. Module 5, which are the ways of preventing COVID-19 transmission. It is important to take note. There is quite a lot as well, and generally we know hand washing is very important. Constant hand washing after being exposed to anything that could be contaminated with the COVID-19 virus. This way, it also reduces the transmission by using your soap and water for at least 20 seconds, or you can make use of a 70% alcohol-based hand sanitizer, which can also de-germ the virus around your hands. Always make sure that you do consistently wash your hands during this time, as you can reduce the risk of contacting the virus. Another way is avoiding touching your face. Your eyes, your nose, and your mouth are very sensitive areas of your body and can also easily contact any virus around your hands or any part of your body. So avoid touching your face. Hand hygiene also reduces the risk of contacting COVID-19. Another way is also limiting contact with others. We all know that we had lockdown. Lockdown restricted anyone from being outside their house for no reason. We had essential workers that were around, Gatherings were restricted. We only had to leave the house for basically essentials, which was actually another way of preventing the transmission of COVID-19. It can also assist in terms of um, helping with spreading the virus through the elderly, the ill, or the infected individuals. Also, try to keep a distance away. This can be done by isolation if one is suspected to be infected with the virus. It is very vital that they keep away. They keep isolated during this time and just quarantine for a few days while they recover from the virus. Another step for preventing the COVID-19 and transmission is staying home if you are feeling unwell. It is very important that you self-isolate yourself during this time and limit, once again, social interactions, and just try and have time to recover while you go through what you're going through, as your body in this time is very sensitive. Module 6, which are the dynamics of COVID-19 testing. Testing of individual for the COVID-19. So in this case, the different ways of testing will include a scientific process which uses the techniques of identifying the infection of COVID-19, where a sample of high amounts is taken from an individual and undergoes a testing of the antigen um, through for the COVID-19. And then we have contact tracing, which uses patient interviews, medical and transaction information to locate thousands of individuals connected to the epidemics, however, do face challenges to ongoing viral transmission. Another way of dynamics of COVID-19 testing is the population scale testing, which is a way to detect pre-symptomatic, mildly symptomatic, and asymptomatic individuals by assessing the incidence of the COVID-19 transmission and the fatality rates and how fast the virus spreads, which also helps with detecting the statistics of how many cases we have thus far. Another way is the environmental testing, which detects COVID-19 in a large scale in areas, providing community statistics and the objective monitoring in restricted residential settings. This also helps just to keep in mind which areas can be avoided. There would be some places which were highly infected by the COVID-19, which have a large number of cases reported and large number of deaths reported. So the environmental testing also assists with those statistics in terms of finding out how far and how fast the COVID-19 spreads in which areas. And then the last dynamic that we'll be discussing is the surveillance testing, which also aims to detect early and just to stop the spread. And then we have another module, which is what to do when you are infected with COVID-19. Yes, when you are infected with COVID-19, we would panic and we would want assistance immediately. However, once your COVID-19 test results come out positive, you need to follow the following guidelines to manage the disease. Avoid public transport. This is very important because in this case, you don't have to spread the disease any more further. And try to self-isolate in this time, because the more you are in an exposed space, you therefore have high chances of spreading the virus to different people. And also avoid sharing bathrooms, as it may be difficult. Try and clean if it is a common bathroom, try and clean and sanitize the area after use, so that another person does not contaminate the same a virus as you would be self-isolating. Also clean the surfaces regularly, and just keep monitoring your symptoms as to how severe your case is, and so on. The last module is what to do and what treatments to get once you are tested positive with COVID-19. There is a high chance of hospitalization in this case when when you are tested positive with COVID-19. The hospitalization can help with antiviral treatments. These treatments can assist at any age, and they can be taken at different levels of COVID-19 infections, as to how severe you are. So the different treatments include the Nimavale with Ritinava, and the Remdesivir and Molnupiravir, which are the antiviral treatments, which one can take at different ages and at different cases as well. It is crucial to contact a healthcare provider to determine if you are eligible to this treatment as well.